and it gets a lot more difficult then, and it gets very difficult for police too. So your engagement, your following through on different things is very, very important. It's something that can help change as well, but I think it's more a collection of things that are going to help us get through this.
Thank you. Go ahead, Commissioner.
Just to kind of piggyback on that, like he was saying, nationwide, we're seeing a drop in crime. I mean, Chicago, we're down 30% in murders here. I'd venture to say that we probably had more murders in Boston last year, and we're going to have more this year, but we've seen a decrease in it. We're down over 30% in robberies, and I think 13% in overall crime. So we're seeing it. There's no, like he said, one silver bullet solution to any of these things. Having the engagement, having the partnership with the community is a big part of it. Like he was saying also about the cooperation and the testifying at court, and Dan brought it up too. I see it not with just shootings or homicide, but just regular crime. When somebody is a victim of a robbery or a theft, they just want their stuff back. They don't want to follow through, and that just really further empowers that offender. So again, when something happens and you're a victim, please follow through, call the police, make the report, go to court, testify against them, hold them accountable. Because when you don't hold them accountable, it's just going to keep right on happening, and someone else is going to be a victim, and someone else can be a worse victim, right? So,
Thanks, Commander. Dan, Mr. O'Shea, since taking over Navy Pier, we haven't, and this is a good thing, we haven't heard of many incidents happening at Navy Pier. Can you give like the secret sauce to that? And I know it's you. I know you're the main ingredient of that sauce. But like, what are you doing over at Navy Pier that has us all interested in knowing how safe you're keeping us?
No, I appreciate that, but it really goes to the men and women that are out there working every day to keep people safe. And the sheriff and the commander are being very modest up here, but their people are out there doing police work in the most difficult times, and we now have a prosecutor that's actually holding people accountable and holding people in prison. I'm sorry, not in prison, but in jail, that need to be held in jail. So when we get that formula right, it really does make for a safer Chicago. As far as Navy Pier, we're just, we've taken a few things to the next level. I applied for and received our armed proprietary security license for my managers at Navy Pier. So all of my managers are now armed and in uniform, which gives us a better presence when dealing with people. Most of the time they just thought they were a security guard, which they are, they're only security guards, but now with the uniform and the weapon on the side, they're really minimal arguments when we ask somebody to leave the pier. The other thing is strong policies. We have that strong policy for the youth escorts. We have a code of conduct at Navy Pier, so we are a private company, a non-profit private company, so we can't ask people to leave our premise if they're not following our code of conduct. And we do hold people accountable. The commander has an officer assigned to the pier on duty. Works afternoons and handles all of our incidents before they escalate into something else. He does a great job in de-escalating a lot of stuff where if it were to just fester, people would call the police and we'd have to take more serious action. But we've also introduced technology into Navy Pier. We have a weapons detection AI technology layered over our cameras that if an exposed weapon or if somebody has a weapon and exposes it at Navy Pier, it sends an alert to our operations center. Our operations center is called Zero Eyes, and their operations center has retired military and retired law enforcement looking at that image. And it's just an image of a weapon. It's not an image of any particular person. So if a weapon is exposed, that goes to the operations center. They say, oh, you know what, it's a squirt gun. We'll just send over an email and let you guys know that we picked up a squirt gun. But if it is a real looking firearm, all of our phones go off, all of our security is immediately notified, and we get an armed response over to that individual immediately. And they can make the assessment whether we need to call the police or not. We're fortunate enough to have a SWAT team down here in the 18th District, which 24/7, they're always patrolling the Central Business District, and we get an immediate response from them as well. And then, we've got some other things that were coming up. We just purchased metal detectors to screen individuals when we have large-scale events like the 4th of July. Those are the evolves. You see them at Wrigley Field, you see them at United Center. They're walk-through metal detection that gives us an idea if somebody is carrying a weapon, and we can address that right there. There is no way for Navy Pier to become a clean facility, and by clean I mean searching everyone that comes in there. You know, we have water taxis, we have Ubers and Lyfts that come in there, we have a hotel that operates 24/7, and now we have a marina. So there's no way for us to search every individual that comes onto Navy Pier like they do at Walt Disney World or other places like that. But these are the layers and the steps that we're taking to keep everyone safe, and I can't thank our partners up here enough. We get a great response over there. Our guys are the help before the help arrives, so we have a great team over there, and no one person can do it alone. It's definitely teamwork.
It's working. Thank you so very much, Steve.
I think you hit the nail on the head. The one thing is community engagement. A lot of people in here don't even know each other, but you guys are probably next door neighbors. And generally, when you know each other, you're creating a safer community. And you know, everybody's on Facebook, and they're on Nextdoor, and they're on 50 different platforms. And what we saw work really well in one community in particular, it's a little bit different than Streeterville, but Bucktown's not too far from here. And we have over 500 plus residents on a Slack channel. I don't know how many people are here familiar with Slack channel, but essentially what it allows them to do is you can't hide behind a screen name, you can't hide behind a username. You're who you are, and you put your address on there. And there's an administration that was created amongst that HOA specifically to administer that. So they're not using a third-party platform. And essentially what that allowed these folks to do is communicate with our officers while they're on patrol. A little bit different, but I'll give you a use case scenario. Especially around the 4th of July, a lot of people mistake gunshots for fireworks. Now, what happened in this community, specifically happens every year, is some of the neighbors go, hey, I heard gunshots down the street. They communicate with our officer will then go and verify if it's gunshots or if it's fireworks. And our dispatchers are actually watching that from our command center. The officer can go, no, it's just some kid lighting off fireworks. What did we just do? We just prevented 500 people calling into 911. And then our officer put a verification along with our dispatch, letting the rest of the community know that it isn't somebody shooting a firearm in the air. So one thing that I would recommend, and I don't know if SOAR has this, is creating perhaps some type of Slack channel where the community here can all communicate together on one singular channel, using your real address, using your real name, and getting to know your neighbors. And this has really evolved, not just from a security standpoint, it's gone to snow plowing, it's gone to having organized block parties. And I'll tell you, we hear from neighbors all the time that go, I didn't even know this person lived down the block from me, and we become good friends through Slack channel. So that's something that I would highly recommend for the community here to do, is use a singular platform, get to know each other, be the eyes and ears for each other, and create some type of administration, or maybe SOAR would be able to do this. But it costs $0 to get to know your neighbor, and it's highly recommended.
Slack channel, I may talk to you about that a little bit later on. It sounds interesting.
We'll set it up for you.
Well, that's at a cost though.
$0.
It's worth it. It's worth it. There's no cost to safety. Linda, are you still here? Is it Dr. Linda? Okay, did you want to come in and ask your question?
Yeah, so in that area specifically, so the question was, are the police on the Slack channel? They get a weekly report of our all the communication that we have on that channel and any incidences that we feel like we need to push up to the police, but they do have access to our Slack channel. Generally what happens is our officers are the first respondent on that channel that are patrolling. Our secondary responders are the dispatchers that sit in our command center, and some of them are former 911 dispatchers. But in any case, we're not there to replace the police. So if we see an incident that happens while we're on patrol, we immediately call 911.
Very interesting. Linda?
Thank you. First of all, I'd like to say thank you to each of you for your public service on behalf of all of us. Thank you. My question has to do with the CARE program. And the CARE you what that means. The Crisis Assistance Response and Engagement Program, the 18th District does not have a program. These are calls that are handled by a trained mental health specialist and an EMT specialist in a mobile van that can go within a matter of minutes to a point where someone is having a mental health crisis, is homeless, is in the process of suiciding, or other homeless issues, well-being issues. And my question is, are you in support of exploring this program for the 18th District, which by the way would only cost a mere $750,000 for the whole year? We are one of the 22 districts, as we know, in Chicago. We do not have this program, and yet we see the need on the street all the time. People have crises. This also would take away unneeded calls to be responded to through 911 by armed officers that are best left to mental health professionals who can go in a heartbeat to the crisis. So my question is, are you in support of further exploring and possibly supporting bringing this program to the 18th District? Thank you.
You know, if I can just speak on this, not necessarily as it applies to the 18th District, but just as a general proposition. So this issue, we've been very engaged with in my office for years now, as it applies to the entire county, because throughout the country, people have struggled with this. The majority of the calls that we all get have a mental health component to it,
Right.
a serious one. And there's no one that I've ever come across in law enforcement who's said, you know, that's why I signed up to be a police officer, because I want to go and work on mental health cases. No, they haven't, but the problem has been is that the system that had been set up forever was that you have an issue, you call 911, and then, well, who's going to show up? Well, of course, police are going to show up.
Right.
And most police would say that they aren't equipped to handle most of this, but they were stuck with it. And so people did the best they could forever with it. In some jurisdictions around the country, they started coming up with a variation to care program where they'd have, basically it was an ambulance type situation, and they'd go there. Most of the jurisdictions where it was being operated were very small. There was one out in Oregon that people kept talking about, and it just was a tiny town, and it worked for them. The one point that I kept making, because I had ongoing discussions with my county board on this thing, was that the ability to scale that, it was very, very expensive. And so when you mentioned that dollar figure, I'd be curious to look at it, and I'm not suggesting you're wrong. I just know that to stand up one of these vehicles, you needed the vehicle, you needed a mental health professional, you needed not a doctor, but you needed like a nurse of some nature, because there was usually that component attached to it. And there was usually complicating factors. And so here's the problem is that these cases are also familiar to all of us up here. And what is almost the norm of these cases is that an individual with a mental health issue, they've had it for an extended period of time, they have a family that cares about them a great deal, they've struggled with this, the family has struggled with this, they have taken care of, this person has lost their job, they are not taking their medications, they've lost their place to live, they're living at home. And so their parents frequently, who love their child, have been working with him or her. They get to a point though where that person hasn't been taking their medications, they strike somebody, they knock someone. So there's a criminal event that occurs. I'm not saying every criminal event you need to arrest people, but when they're calling because they know that they're in a mental health crisis, but there's also an additional thing going on as well. My point though is that when the 911 call comes in, it is very difficult to separate ones that are just pure mental health from ones that have another component to it. And so what has been playing out in Chicago is they attempt the best they can to separate those. And in doing that, it is cut, the universe of calls that would go to the care vehicle was very small. And so, is it helpful? Yeah, it is. What we ended up doing though, because as I said, greater minds than mine have been discussing this issue, and it kept coming back to the cost, and scalability. While all that was going on, I said, listen, I'm going to try something different. And so I trained all my police officers in not just de-escalation techniques, but mental health. They have basically extensive mental health training as well. In addition to that, here's the big thing. They all have tablets, and those tablets, 24/7, they can dial up a mental health professional that I hired. And it's more than one, obviously. So when they go to the home on the 911 call, and mind you, we have a mental health professional at the 911 center to try to segregate some of these calls, but it's very tricky. But when they show up there, they go to the house with the tablet. And if the person is calmed down enough, they hand the tablet to them, and the police officer just backs away. And then they're just on the tablet with a mental health professional. I've watched body-worn camera footage, because we use this all the time, and the footage is stunning. It's absolutely stunning. How they connect, how the person who otherwise was barricaded in a bedroom with a knife is now opened the door and walked out the door and gotten into an ambulance and headed off to the hospital. I'm not saying, I told people, it's not perfect, but while we're debating this other item, which is very expensive, these people deserve proper care. And the tablet is wildly inexpensive. For us to fund the position for the mental health specialist, not very expensive either. I was adamant about trying to get this out to the entire county. I now have 48 out of 130 towns and villages that are in Cook County. I have 48 of them that are on the program. They pay for their tablets. I provide the mental health professional. And the stories are amazing. Because as I say, law enforcement never wanted this duty. We were stuck with it. So this is good. I am absolutely not saying it's the perfect situation, but it's what we can do right now that is wildly helpful. And whether or not the care can expand into 18th district, that would be a question, frankly, for the alderman and the mayor's office, because I just read in the newspaper, nothing more, that because of the funding that had come through via COVID money, they lost some of it that was going to care. So I think they're struggling just to maintain the number they have right now. So I think there's like complete buy-in that I've heard from law enforcement. Law enforcement loves the concept. There's just the question of the funding.
Okay, thank you very much.
That was a great question, thank you.
So, I know that the care unit is not available here, and I am a new resident of this area. In the area where I was living before, Little Village, as I understand, police officers, that's not what they're, grow up, they're like, I want to deal with mental patients. I was offered training for free, actually, on de-escalation and 911 and how to deal with people who are having a mental health episode or drug episode. I also understand that the Chicago Police Department is not required to have that training. If that training is not available, if the caravan is not available here, would anybody here be wanting to have the police officers have that training so things won't happen as they did, at least in my community? For example, a man in January they were responding to 911 call. It was mental distress. He was very sick, and at a senior home, he was shot 20 times, weighing 120 pounds and sick with cancer. So how would that translate here in this community where I see there's a lot of homeless people with mental health issues and drug issues? How can we get, if the care team is not available, how can we ensure that the police officers are ready for that type of response?
So I can answer. We have officers trained to deal with people in mental health crisis. They're CIT trained officers. They're on every watch in every district. They are identified on the sheets each day so that when there's any type of a 911 call that has a mental health component, they are given the assignment. They're dispatched to it. Like I said, they have the training in dealing with people suffering from mental issues, suffering from issues related to drug addiction and whatnot. And that's how we respond to it. We've also, even though we don't have the care unit here, we have used them to address some ongoing homeless issues and mental health issues that we've had in the district. Sergeant Shank from our CAPS office used them like twice in the last month just to go out on initiatives to help deal with some people that are chronic. They're homeless that we get chronic complaints about, and we're trying to get them the care that they need.
And one more question, I'm sorry.
This is gonna have to be super quick.
Yes.
but this is an important topic.
And as you spoke to tonight, that these, the residents are the eyes and ears of the community. How should the response be from the eyes and ears of the community for those people that are homeless and perhaps having mental health issues, living specifically in some areas? Like, is there a community outreach from the police already addressing these people, and or is there a specific number or process that the residents should be taking to address homelessness that they see daily around their building or specific shopping area?
Thank you so much.
Yeah, again, from our community policing office, we actually have an officer assigned as like our homeless officer that goes out and addresses the issue, right? We'll try to get them the services, tries to address any type of encampments that are starting to get put together. You can always, if there's a criminal nexus, if there's something of an emergency, that's definitely something that you have to call 911 about. You can always contact our station, contact our community policing office about a homeless issue that you're seeing develop in your area or in your neighborhood, whether it's one individual or sometimes you're seeing maybe a group congregating, and we will definitely follow up on it. We're regularly following up on it.
And Nick, can I add really quickly?
Right.
I really appreciate what the commander stated. The 18th District Police have been incredibly helpful. As long as you're working with them, these are their long-term concerns. And so it's not a snap of a finger, especially if there's been somebody living in a bus shelter by you for quite some time. The commander and Sergeant Shank's teams have been absolutely wonderful, again, if you're in conversation. The other resource, as we were talking about, CPD cannot solve nor should solve all of these issues. Reach out to your alderman, again, very good alderman locally. This can sometimes be DCFS, which is Children and Family Services. You want to, if you can, reach out to the alderman's office, do it in numbers, coordinate it with your residents, and ask the alderman's office to help coordinate other resources from the city to try to address the concern.
One other thing too, get involved with your beat meetings. Come to the beat meetings. Those are good places to discuss some of these issues with the CAPS office and the beat officers, and to kind of collaborate with them on getting some of these things worked out.
Thanks, that's me, by the way. I'm the CAPS coordinator for 1833 and 1834, and we meet every other month on the fourth Thursday. So our next one will be September 20-something, but look for the news.
Thanks, Denise. So we heard a couple themes this evening. I know we're getting close to time, but I think if we wanted to summarize this, like what's top of mind? If you had a rapid fire, 2 minutes, what's top of your mind right now as it relates to safety? And we can just go down the row here. Or we can start with Gwen. No eye contact. That was no eye contact. That's all you did there, Gwen.
At the top of my agenda, as I said, every morning when I come in, after I park my vehicle at 401, I walk Michigan Avenue all the way down to Oak Street. I make observation, make assessments, and confer with the 18th district staff of what I've seen. In addition, I make, what would you call it, 311 service requests. Signs that are knocked down by traffic accidents that occurred overnight. I remember last year when I first started, there was a person that was experiencing a mental episode that went up and down Michigan Avenue breaking windows. They broke a window out at Ralph Lauren, they broke one out at Neiman Marcus, they broke one out at Tiffany, and they broke three bus shelter windows. It's a very expensive excursion, if you want to call it. The window at Neiman Marcus cost $20,000 to replace. It had to be baked and shipped from New York by ground. So these are the things I look for every morning and make my referrals and recommendations to the 18th district to make sure everything is safe on Michigan Avenue for the tourists or the visitors that we're going to see that day.
Top of mind is always, how do we make the city safer, as well as Navy Pier. And it's through events like this, your collaboration along with all of our law enforcement partners and our elected officials, and everyone's got to get on the same page moving forward. People need to be held accountable, there's no doubt about it, and there's tons of programs to help the homeless, and there's even a drug diversion program for low-level drug offenders in the city that we need to lean in on and really push those programs forward so our first responders can respond to violent crime. And yeah, the accountability is a big thing. I'm happy to see the state's attorney's office, like I mentioned, but we also need our judges to get on board and the Department of Corrections, and then and I think we can get our city back.
My top priority is having you feel safe, okay? I'm not worried about the stats, or I'm not gonna come in and say, well, crime's down, we're down 30%, 40%, 50%. My concern is how you all feel, and I want you to feel safe, and that's paramount to me. And that's why I do take serious all the issues that you bring up that many times people would think are low-level issues, people with mental health issues, people loitering, panhandling. That all contributes to how you're gonna feel and how your community's gonna be safe. So I do take that seriously, and being able to work with you and communicate with you, I think we can address a lot of the issues that you have.
Yeah, I couldn't agree with the commander more on that one, because there's a lot of times where people put up their graphs and all the charts and things like that, and they show this is going down, that's going down. It really does come down to, commander said, how you feel, and that's important. It used to be sort of blown off. It's like, oh wow, you don't feel good. But no, the reality is, if you don't feel good about your safety and security, there's a range of things you're just not going to do anymore, and that's going to negatively impact the entire area. And so things like this, your engagement, having people like this who really care and are dedicated is so helpful. I just can't emphasize enough to you, when we got involved with the retail theft element of it down here and started working with all these businesses, great business people, but then there was a lot of them that just blew me away, who had no interest in prosecuting anything. And I kept suggesting to people that makes no sense. I went down and met with some of the security people myself, and they say, no, from the top on down, we were told just to let people walk out the door. And so then we started engaging with the CEOs of companies and things like that, saying, listen, you can't do this. Not only for whatever, for your own bottom line, it makes no sense, but it affects the rest of the area, because people come in there then, because they know no one's prosecuting things. And so that was a complicated issue, as I said, because there was issues with whether cases were being thrown out and all the rest of that stuff. And I felt a lot of sympathy for the business people, but it was a requirement that they stepped up to and acted like they're members of this community, that we're all serious, we're all engaged, and we're all in this together. So it really is that, and then that feeling comes back. That feeling comes back of safety and security. You're not afraid to go walk your dog at night. You're not afraid to do those things because you're feeling good about it. So these are not easy issues. They're very complicated with many, many threads, but as long as people are in this together, we'll get through this thing. We will.
Top of mind after listening to everybody here, I think the public-private partnership is stronger than it's ever been. I'm just a private entity guy with a lot of folks that work on the public side that work for us, but being able to sit here with residents like yourself, with an institution like Northwestern Hospital, the Sheriff's Department, CPD, Brad, the community's coming together. COVID ruined a lot of things for a long time. And I think going back to just having everybody sit in this room right now, there's a lot of people that care about this community. And I think having these meetings maybe once a quarter or once a month isn't enough. I think being able to get to know your neighbors, creating a channel where you verify who everybody is, and having that community engagement every single day to look out for each other on potential opportunities of crime, and communicating that, whether it's us, whether it's CPD, whether it's the Sheriff's Department, is a really good start. And I think, you know, it doesn't have to be an engagement like this where everybody's sitting in the same room. You have Zoom, you have Teams, you have a lot of things where you can get a few thousand people to join. There's over, I think, 30,000 residents in the Streeterville area. Imagine if you have 1,000 of those residents that are responsible to be a block captain or a captain for their own property or it's a commercial building, and being that liaison between that business they care for, that park they care for, and being that voice to communicate among Slack or whatever platform you guys decide on. I'm more than happy to work with SOAR to start that. But I think that is really a good start. Is coming together as a neighborhood, having each other's backs, and effectively communicating about things that we can do to reduce crime in the area is a really good start. So I appreciate everybody coming out.
I very much appreciate Steve's comments and the other panelists' comments. There's really three top-of-mind items, and they were reinforced tonight in various ways. It's three S's, you know, it's sidewalks, streets, and stores. I continually work on this along with my colleagues and Bob Johnson who's in the front row and all of you, but we think about safe sidewalks. I think about, again, those quality of life issues, whether it's scooters, whether it's bicycles, whether it's cars that are not obeying sidewalk rules or crossing walk rules, whether it's mental health support that's needed to create safer sidewalks or addiction support, safe streets. Again, we didn't talk about it too much tonight, but noise disturbances, noise violations, drag racing, not following the rules of the road, safe stores, thinking about all the retail theft that the colleagues across the table have worked so diligently on, but thinking about the retail theft and thinking about how to stem the theft and understand what the security is doing, let's say at a store, or how to get the resources. So sidewalks, streets, and stores, very focused on trying to support the community getting those three things back.
Wow, that was a powerful close. I'm going to make this real quick because we're right at time, but I just want to acknowledge, I think everyone in here, if you haven't already, their jobs are not easy. Like, it's real